So how do you make the diagnosis besides careful interview? I mean, major depression still remains a clinical diagnosis based on the interview, based on ruling out other considerations. Uh, but what we do in the clinic is often use rating scales to help us assess severity of illness. So these rating scales are not diagnostic instruments themselves. They don't make the diagnosis, but they can help guide the clinician and guide yourself, guide the patient. How severe is this? Are we talking mild, moderate, severe, or very severe? And two of the most common are listed here. One is the quick inventory of depressive symptomatology. And then what's most commonly used in clinical practice, and many practice settings adopt this scale, they call the PHQ-9. It's a screener, and it's asking you over the past 2 weeks, how often have you been bothered by any of the following problems? And then it lists the 9 cardinal symptoms of depression, and then you get a severity score. And this is something that's freely downloadable for patients. There's a link to this questionnaire. So it's useful information for a patient to bring to their appointment so the doctor can have a sense. And if you're in that 20 to 27 category, that would trigger a specific type of treatment versus if you are in fact mild. I mean, mild depression usually does fine with reassurance, often with time, with some focused psychotherapy, some behavioral interventions. Exercise is an outstanding intervention. Relaxation type therapies, group therapies. There's all kinds of options for milder forms of depression that doesn't involve drug therapy or neuromodulation type approaches. Now, once we're getting into moderate, severe, or severe, you may be thinking more along the lines of medication or neuromodulation. And we'll get into those in a second, and subsequent webinars will get into much more detail on that.